So there are a lot of threads available in the market which contain different constituents. It could be PDO threads, PLA threads, PLLA threads, caprolactone, and these are just medical grade constituents of a thread, and it is what gives the toughness to the thread and the lifting capacity to the thread. Aptos is one of the first threads that I experienced, which had hyaluronic acid incorporated along with poly-L-lactic acid, polyglycolic acid, and caprolactone. So it has 4-in-1. Why I would like to use hyaluronic acid in a lot of patients who are looking for a face and neck lift, because as we know, hyaluronic acid is a naturally occurring sugar in the body and it is needed also for improvement in skin quality. So I would choose a thread which contains hyaluronic acid for those where I'm also looking to improvise on skin quality, skin texture, a little bit of suppleness and hydration, which is seen along with the lift. And those who have a very good skin, I think ones without.
It is absolutely and always an outpatient procedure. We call it a walk-in, walk-out procedure. It takes about 30 to 45 minutes. And once you're done with the procedure, we give you some painkillers and then we send you home. Of course, you're going to have a little bit of redness, some areas bruising at times, and a mild swelling on the face. I would say post a thread lift, you should take about 10 to 14 days as a downtime period. We give you a list of instructions, which also I will put in the next story. So these are the things you should and should not do for about 2 weeks after the thread lift procedure. We give you antibiotics and a few anti-inflammatory drugs for about 5 days that will help to relieve the discomfort.
Well, Aptos does have threads for the body. It is used for certain mild sagging in the arms, a little bit of tightening in the arms and the inner thigh. However, it all depends on the quality of skin, the extent of laxity, and are there stretch marks, not. I would have to see you in person, assess what grade of sagging you have. Very personally speaking, many threads would be needed, at least 30 to 40 threads for each breast in order to give a very mild amount of lift, and that also if you have a very mild grade of sagging. Anything above a grade 1, I don't think the threads work. Also, if the threads do work, you may not see the results lasting as long as how you see it on the face and the neck. So I personally like to use the face threads for the face and the neck. However, for the body, I found the results may not be as effective. I don't know how happy you would be, and every 1 year you would have to repeat it. Well, surgery is your only option to lift as well as augment the breast. There are two aspects to this. One is the lifting capacity. Now, when we talk about lift, yes, we spoke about the non-surgical thread lift, but that is used for breasts which are very mildly sagging, and also if they have a very good skin quality, a large amount of threads would be needed and it is not permanent. Surgery is the only permanent option where we can exactly, and any person having sagging of breasts, which is grade 1, grade 2, we grade it scientifically, medically in various ways. Surgery is your only option. The other option is volume giving augmentation. The two ways, non-surgically, you can have body fillers, again temporary, last for 2 years. It is 3 times more expensive. So ideally, worldwide, surgery is your best option and only option most times for lift and augmentation. So it's very difficult to quickly explain in a minute the entire procedure of thread lift, but quickly telling you, we give a little bit of local anesthetic at few points from where we are going to introduce the thread, and the threads are introduced from points which are not visible through very tiny needles. Thread by itself contain barbs on it. In the next story, I'm going to put links to our YouTube videos as well as the videos that I have put on Instagram which explain the procedure of thread lift in detail, but it's usually 30 to 45 minutes, little bit of local anesthesia. These fine barbed threads are introduced in areas in order to lift the particular tissue that we need to lift. So what the barbs in the thread does is hitches onto the tissues that we're introducing. So we introduce the threads and we pull the skin up in areas that we require to lift. The barbs on the thread hitch the tissues, create a scar formation, and that's how you get your lifting effect.